tell me, what were your symptoms before the surgery?
The symptoms before the surgery were the thoracic part of the back is where I was having severe
just
pain.
this area, correct?
Yep.
Yeah, that is neck and chest
Right.
kind
And
of border.
I had very little pain in the neck and the shoulders until this last time before I came and saw you. Then when you did that MRI and we saw what was wrong.
Yeah. Now, what was wrong is that here, most of your neck was growing by itself. We call it spontaneous ankylosis, except this level. And this level that wasn't growing, look at that, below and above, it was all growing. And this level wasn't growing and pushing all the material of the disc toward the nerve. We went there and we did what we call a double plating technique, where I put a spacer and I put screws on a small plate first and then put a bigger screws on top to literally stabilize your spine. And by doing that, what we are trying to do is not needing to go from the front and back, because generally in a situation like that, if you have only place that motion left is here, we have to go from the front and the back to put screws in front and back, multiple levels. Otherwise it wouldn't be stable. The screws will pull out. They're not strong enough. But with this technique, actually, and this surgery was done 4 months ago, correct?
Right.
Correct.
So how are you now?
How am I now?
Yeah.
The thoracic part of the back is probably 90% better.
So you use the word day and night.
Yep.
Yeah.
Yeah.
So,
And I'm able to take this off the brace
Good,
now
good, yeah.
for quite a while during
Yeah.
the day if I'm in the house.
the bone is growing. Here it is. The bone start to grow, but as usual, it's at first weaker bone, but it'll going to become stronger bone with the time. So we just have to be a little careful.
Okay.
And we can slowly, very slowly, under small increment of increasing activity, make you a normal person again. You notice that you don't have much motion left in your neck.
Right.
But that has nothing to do with our surgery. Your bone is growing in all the levels, but you're still able to do things, right?
Oh, yes.
Oh, yeah.
Yes. I can mow the grass, like I said. I can walk. I can. I don't go running around anymore, but most of the work that I'm starting to get back to do more and more all the time.
And it's going to get even better.
I
Okay.
hope so.
Now you're not going to be 20 years old anymore.
No,
But
no.
you can. Yeah, I know. Yeah. And that disappoints her that you cannot be 20 anymore.
Yeah. But I will say this much here: weather does play a factor in how
Yeah.
Yeah,
how
certainly
this
does.
feels.
Yeah, yeah.
And
Well, we have a long way to go. We are on the right path, and you have a good common sense. Slowly add to activities, and I see you in a few months. Okay.
Okay,
Thank you
sounds
so much for the interview. I appreciate
thank
that.
you.